The foot mechanic, what does it mean? Well, it's actually a very highly technical skill. Dr. Brett Purdom is with us, and I really love what you do. The first time you came on, you talked about how the feet are a foundation, and we'll be introducing her in a second. The feet, the foundation to your body.
Absolutely, yeah. It all starts with the feet.
And you can then, therefore, help knees with the proper foundation. Of course, feet, back, neck. Let's talk about pregnancy. You wanted to talk today about pregnancy, and this is remarkable what you taught me.
Yeah, really what we were talking about earlier, Tom Offset, is that a woman athlete goes through certain periods in her life. And she might start out actually as a runner or cyclist or somebody like that. And what happens is...
And you want to see this video now?
Oh, sure.
Okay.
Yeah. And so what's going to happen is we're going to look at a video here.
And relaxin.
Relaxin is a hormone that basically a woman will actually produce during menstruation. It reaches its peak generally around the 14th day of menstruation.
And that's meant to be an assist in delivering babies, right?
Basically, yeah. You have you've got the pubic bones that come together, and they're held together by a ligament, and that ligament is softened by this relaxin. But it actually is delivered through the bloodstream. So it goes to all the ligaments in the body. So what you're going to see next here is actually the arterial system just goes down the legs. So it not only goes to that area in the pelvis, but it also goes down the legs. So this is the area where during childbirth,
sure,
where
it would
the
relax
hips
and open. Right.
However, remember, we have ligaments all the way through the body, and they connect bone to bone, and they give structural integrity. Here it is about the knee, and now we're going to zoom in. We're going to actually look at the foot and ankle. There's 28 bones in the foot and ankle, and there's over 50 ligaments, and they give you structural foundation. Well, this relaxin actually causes that to soften. We're looking here, Tom, at normal alignment. Let's say that this woman hasn't gone through childbirthing, and that's normal alignment. Using the kneecap, this is a great video. Check this out. This is how the knee is supposed to slide. We're going to play this three times.
Okay.
Now, the kneecap should slide like a train on a track. Okay? That's in normal alignment.
With normal fluids.
Okay, but what happens is we have relaxin with normal alignment. What happens is it kind of causes everything to sort of shift. Exactly.
Like the name implies.
Right, just so that all those ligaments on the bottom of the feet, they shift and the foundation shifts. And now this normal mechanism no longer can occur. And it kind of, the train gets out of track.
Right.
So you get knee issues. And then what we know about the gait cycle, Tom, this is great stuff. When the foot hits the ground, you apply 3 to 5 times more force on the body.
Because it's not properly cushioned.
Exactly. And now that's why we get women developing foot issues.
And back issues.
And knee issues.
Long after pregnancy.
All the way up. Yeah, exactly.
Long after pregnancy. And Debbie Saya.
Yes.
Or Saya.
Saya.
Saya. You're a patient. Now, you were pregnant. And what did your shoe size do?
It started at a 6.5. And after giving birth to 3 children, it's now an 8.
That's not unusual to go.
Not unusual at all.
To increase a foot size or a foot size and a half.
Yeah. Many women will always say that, yeah.
And it doesn't go back.
Doesn't go back.
So what did you experience pain, Debbie?
I did. I did foot pain, knee pain, hip pain, mostly knee and hip.
And what did Dr. Purdom do for you?
He fit me with orthotics after thoroughly looking at my feet and how it lands
and thoroughly,
when I walk.
we mean thoroughly. It's not just, oh, here, take these.
Exactly.
You go through scientific testing methods, screening.
Takes about an hour to get through that.
You have
and here we go again. These are actually Debbie's feet.
And this is a screening that you can't just have done in a store where you stand at something.
What we're doing right now is we're looking at the foot, and that's where she should be. And then notice the normal knee alignment right there?
Yes.
And now what we're going to have her do is do that on the other leg. And what you're going to see how the knee moves in? And the foot? There's ideal. And now this is her stepping on her orthotics.
Can you reshape then the way their feet hit the ground and therefore retrain all those ligaments?
We know exactly what they should do, Tom, and we're going to go ahead and put them back in the normal alignment. That which relaxin
and this is incredible.
This is great. Yep. And nobody else looks at this, Tom. biomechanically, or the way people move.
Look at that. You look exactly what's happening, and you can track your progress.
More importantly, we can teach the client what's going on, and you're going to see that coming up here next, where we actually take the client and teach them about how their foot is hitting the ground every 60 milliseconds. You can see how that is rather aberrant. I mean, those lines should be straight up and down. Well, you have relaxin, it goes down to the foot, and all of a sudden it changes the entire dynamic. Knees start collapsing inward, and we start having tissue problems all the way across.
Debbie, did you notice a difference?
Absolutely. Absolutely.
Yes. Yeah, and I mean, it just cleared up the pain.
It did. It did. It alleviated the pain, and I was able to go back to doing all the things that I love to do without the pain, which is wonderful.
You hear these stories all the time.
Well, yeah, I mean, we have a 90% success rate, and if people aren't happy, they keep coming back at no further cost.
But really?
No further cost until we get them right. Yeah, absolutely. If we look at what we see, Tom, and we know that they're in improper alignment, we know how to get them to the right alignment, then they own us and we own them until they're better.
And this is not a simple structure to deal with.
Absolutely. You're looking at 28 bones right there, Tom.
Not to mention the ligaments.
They're all connected by ligaments.
Maybe you should call yourself the knee mechanic too,
Well,
because it
and the
cleared up her
hip
knee.
and
hip
and the
mechanic.
lower back.
The body mechanic.
Absolutely.
Well, of course, it all starts with the foundation. Here's a special offer. That extensive evaluation you saw, take $50 off it. $50 off that extensive evaluation. And you mentioned Martino TV. Here it is, $50 off. Here's the number, 303-807-3974. 303-807-3974. Online, thefootmechanic.com. Thefootmechanic.com. 303-807-3974. Remember, $50 off that screening, a complete evaluation, and it could end your pain. Paula?